Hi, my name is Dr. Stephen Child. I'm a Director of Clinical Training and a General Physician at Auckland District Health Board. As a conference, it's actually very, very unique and probably one of the best conferences that I've attended in a long time. The reason I say that is because you get an opportunity to chat informally to your colleagues, and colleagues from a large variety of different specialties, and finding out what the common things that are facing us in our job as doctors has been really, really interesting. I've probably got more out of some of the conversations around the dinner table than I have about some of the lectures at times. I've learned about renal tubular acidosis in the cases that we were presenting yesterday. I've learned about how to inject joints of musculoskeletal joints, when it's useful and when it's not useful in osteoarthritis, especially of the C-spine. So lots of different things that I wouldn't necessarily learn in the usual conferences that I attend. This is one of the best trips/holidays that I've ever had. And I realize it's because you combine rest and relaxation with education, with interesting people, interesting places, and a bit of physical activity with diving and whatever you want to do as well. So it's just a perfect combination of a holiday, and you come back feeling relaxed, interested in the people that you've been meeting, but also a really interesting educational experience that gives you a different look at the practice of medicine. Highlight of my trip, this trip anyway, was probably the same as the low light of my trip actually, which was when we did a little clinic on a small village and found a 5-year-old boy who had a congenital heart disease that was very, very sick.
No.
You can't run around.
He can walk, but it's just very weak.
He has a problem with his heart.
Just hit home to me immediately that the light-hearted approach that we'd initially taken to the clinic of seeing bronchiolitis, seeing skin infections, seeing urinary tract infections, etc., suddenly hit home very, very hard when you realize that the amount of medicine that we are able to provide to patients in our home countries is so much better than the medicine that these people are being offered in the small islands. And that the value of human life takes on a completely different meaning. So my highlight was my low light on this trip.
He's malnourished and he's pale, so he really needs a lot of, if he's not going to die, he needs a lot of help right now.